All right, so you just had a baby. You know what's probably going to happen next? Yeah, we're going to talk about that right now. Okay, so you get a call for someone in labor. Let's just back up and talk about what's probably going to happen, right? And I'm mostly talking to pre-hospital providers, 15 years in the ER. Here's every pregnant patient I've ever seen in the ER. Oh, the pregnant patient's here, she's gone. You wouldn't be able to identify her in a lineup. You'd be like, officer, it happened so fast. I didn't even get a good look at her. And you know what? Perfect. Get her up there to the baby people. That's where she belongs. So I'm really talking to pre-hospital people. Now, so when you get the call, you're going to be in basically three categories. You got your 90%, your 9%, and your 1%. 90% is best. That's great. This is 90% of the time, everything's going to be fine, right? Everything will be fine. Now, how do you know you're in the 90% category? When baby comes out, they are screaming at you. They are yelling at you. They are fighting with you. They are making lots of noise and fuss. They threaten you. Put me back. Congratulations, you're in the 90% category. Everything's going to be fine. From there, you go to the initial steps. Okay, so that's the 90% category. And remember, this is what's going to happen 90% of the time. So go into the event expecting this. I mean, this is going to be a happy occasion. Somebody's having a baby. This is awesome. My favorite thing in the whole world to do would be to help deliver a baby. It's awesome. So with that, let's move to the 9% category. And what is a 9% category? First off, it's not that 90% category. Not at all. This is a child that is might be breathing but insufficiently. And really that 9% covers a lot of gamut, really all the way from poor saturation all the way up to needing assistance breathing initially. So that 9% really deals with airway management and oxygenating and ventilating this newborn. It's all about that. What you do, we'll discuss that in the algorithm. There's a couple of things we look at. But if you're in that 9% category, you're going to need some airway management. Sometimes all you have to do are the initial steps, right? The stimulating, the warming, the touching, all that stimulates the child to breathe and you're out of the woods. Maybe that's all they needed. That's it. The 1%, which is still a lot of births, tragically per year, needs full resuscitation. That's chest compressions, advanced airway maneuvers, medications, expert consultation immediately, and experts who really know how to deal with a loss of life, especially if it's a premature baby or something happens during the delivery, unexpected complication. You want to have an expert involved with this. Okay, so that's just a quick rundown. 90% of the time, everything's fine. Don't drop the baby. 9% of the time, that's when we look in the algorithm and we are increasing our airway maneuvers. We're getting more and more advanced with our airway management based on this newborn's needs. That's that 9%. The 1% is the full cord press. We're coding the child, coding the newborn. So one of the big takeaways from NRP is no matter how this child presents, the first thing we do is our initial steps, the stimulating, the warming, the drying. Doesn't matter how this child presents. They come out kicking and screaming, flaccid, ordering in French, doesn't matter. Every birth, no matter how they present, gets the initial steps right off the bat. My name's Mark, thanks for watching. See you in the next video.